Hello, welcome back to Physio4U. In today's video, we'll talk about physiotherapy. What is physiotherapy? I am Ekaterini Zyaka, I am a physical therapist and I work almost in any case with patients with many disabilities, and I work with adults and children. So, what is physiotherapy? Physiotherapy is a science. It aims to help people restore movement and function. Physical therapy can help someone recover from injuries, trauma, illness, or any other disability that is related to pain or restrictions in daily life activities. Physical therapy is provided by physical therapists who promote, maintain and restore the well-being through examination, through diagnosis, prognosis, patient education, physiotherapeutic intervention, rehabilitation, disease prevention and health promotion. Why do I need physiotherapy? Physiotherapy is also known as physical therapy, helps someone be active in their daily life activities while helping them remain independent. The main goal of a physiotherapist is to help the patient manage the pain, prevent injuries and restore their health and fitness. Physiotherapy is a degree-based healthcare profession, and the physiotherapist uses his knowledge and skills to improve dysfunctions related to a different system of the body. Physiotherapists can specialize in several diseases. There are four main fields of physiotherapy: cardiorespiratory, also known as cardiopulmonary or cardiovascular field, and it deals with conditions related to heart and lungs and all the circulatory system, especially bronchial asthma, pneumothorax, chronic obstructive lungs diseases and other. Musculoskeletal field of physiotherapy deals with injuries related to bones, joints and muscles, and this field is also known as orthopedic field. Neurology field of physiotherapy deals with rehabilitation of patients recovering from neurological disorders such as stroke, dementia, Parkinson's disease, multiple sclerosis, side effects from brain surgery, etc. Pediatric rehabilitation concerns neurological dysfunctions like cerebral palsy, syndromes, autism malfunctions and other similar disabilities. What does a physiotherapist do? A physiotherapist is a healthcare professional who works with patients with all types of dysfunctions or limitations. A physiotherapist or physical therapist works with patients to recover from injury, reduce pain, induce mobility, manage the balance. Physical therapists are trained to develop customized programs to restore as much as possible the patient's functional ability and movement at all stages of their life, even from birth. The first time that the patient meets the physiotherapist, a detailed history is recorded of their dysfunctions. And the patient discusses all the problems that he has with the physiotherapist, and then follows an evaluation of their muscles, their muscular tone, the muscle system and the vestibular system, respiratory system, vascular system and everything that relates with their health, and gives the necessary information of their problems. After all that, the physiotherapist organizes the unique and personalized program to achieve all the goals that have been set. Physiotherapists in clinical practice involve patients in their own care through education, awareness, empowerment, and participation in their treatment. In addition, a physical therapist's practice includes research, education, and health management. Physical therapy is provided as a primary care treatment or in combination with other medical services. How does physiotherapy work? Physiotherapy as a healthcare profession assists people to restore, improve, maintain their function and prevent recurrences of their dysfunctions. They often work in a team with other medical professionals to help a patient improve their motion and health in daily life activities. Physiotherapists as healthcare practitioners have in-depth knowledge of the human body and how human body works. So physiotherapy practitioners specialize in techniques and approaches to diagnose, treat and cure patients' disabilities. The most common techniques of physiotherapy is kinesiotherapy, electrotherapy, ultrasound therapy, tape therapy, tractions, acupuncture therapy, mirror therapy, cold and hot patches, soft splints therapy, soft tissue mobilization, also known as therapeutic massage, SIMT therapy, and others. Kinesiotherapy is the most common, in any case, treatment and improves the patient's movement and function. Being active is the brain's cure. According to the American Kinesiotherapy Association, it is the application of scientifically based exercise principles adapted to enhance the strength, endurance and mobility of individuals with functional limitations. The word kinesiotherapy literally means movement therapy, and kinesiotherapists use the principle of movement to address a person's injury or disability. After that, this principle is incorporated into a program of rehabilitation consisting of active or passive exercise. Electrotherapy includes a range of treatments using electricity to reduce pain, improve circulation, repair tissues, strengthen muscles, and promote bone growth, leading to improvements in physical functioning. Ultrasound therapy is a treatment used by physical therapists to relieve pain and to promote tissue healing. Tape therapy is used to support and relieve pain in muscles, joints, and ligaments. Proper taping also enables weak muscles to function efficiently, reduces pain and fatigue, and protects against cramping, overextension, and overcontractions. Traction is a manual technique designed to reduce pressure on affected vertebral discs that are causing pain. Traction is a manual stretching of the spine, and this technique used to stretch soft tissues and separate joints surfaces or bone fragments using a pulling force. Acupuncture therapy is a form of treatment that involves inserting very thin needles through a person's skin at specific points on the body to various depths. Research suggests that it can help relieve pain, and it is used for a wide range of other complaints. Acupuncture points are believed to stimulate the central nervous system, and this in turn releases chemical into the muscles, spinal cord and brain, and these biochemical changes may stimulate the body's natural healing process and promote physical and emotional well-being. Mirror therapy is a type of therapy that uses vision to treat the function in hemiplegia or the pain that people with amputated limbs sometimes feel in their missing limbs. The principle of mirror therapy is the use of a mirror to create a reflecting illusion of an affected limb in order to trick the brain into thinking movement has occurred without pain, or to create positive visual feedback of a limb movement. Cold and hot patches, cold treatment reduces inflammation by decreasing blood flow, and heat therapy works by improving circulation and blood flow to a particular area due to increased temperature. Soft splints therapy prevents a body part from moving, according to theory that the treatment of patients is affected by allowing other parts movement. The splint is made of a soft material like tape or soft bandage. Soft tissue mobilization, also known as therapeutic massage, is used to help manage a health condition or enhance wellness. It involves manipulating the soft tissues of the body. CIMT, constraint-induced movement therapy, is a form of rehabilitation therapy that improves upper extremity function in stroke and other central nervous system disorders. CIMT is a specialized approach used to increase the use of a limb affected or weakened as a result of a stroke or brain injury, and aims at decreasing the effects of learned non-use. But what are the most significant approaches in rehabilitation? The most familiar approaches in rehabilitation in physiotherapy are NDT, SI, OMT, osteopathy, visceral manipulation, craniosacral release, and PNF. NDT is neurodevelopmental treatment, and it concerns patients in any age who have disorders in central nervous system or in peripheral nervous system. It's Bobath concept, and it is problem-solving approach used in the evaluation and treatment of individuals or children with movement and postural control disturbances due to a lesion of the central nervous system. It's based on normal development. The name was from Berta and Karel Bobath, and they developed this approach by effective management of neuromotor dysfunctions manifested by children with cerebral palsy. SI, sensory integration therapy, concerns children and adults who deal with the brain's receiving and processing sensory information disorders, and sensory integration therapy aims to help patients with sensory processing issues by exposing them to sensory stimulation in a structured, repetitive way. The theory behind it is that over time the brain will adapt and allow the patients to process and react to sensations more efficiently. This technique is better for difficulties like autism, psychomotor dysfunctions, and others similar to them. PNF, proprioceptive neuromuscular facilitation, concern patients who suffer from CNS and PNS dysfunction. This approach is better for patients who can respond to a command. Osteopathy, which is a holistic and integrated approach, concerns almost every disability in the orthopedic field. Osteopathy is a type of alternative medicine that emphasizes physical manipulation of the body's muscle and bones. Practitioners of osteopathy are referred to us as osteopaths. OMT, orthopedic manipulative therapy, also known as manual therapy, is a physical treatment primarily used by physical therapists, physiotherapists, to treat musculoskeletal pain and disability. Treatment may include moving joints in specific directions and at different speeds to regain movement and muscle stretching, passive movements of the affected body part, or having the patient move the body part against the therapist's resistance to improve muscle activation and timing. VMT, visceral manipulation therapy, cures problems in the visceral, which is believed to be related with many orthopedic or neurokinetic dysfunctions. Viscera relates to the internal organs of the body, and visceral manipulation, or VM, does not occur solely on the site of pain or dysfunctions, but evaluates the entire body to find the source of the problem. CST, craniosacral therapy, is about the craniosacral rhythm, and it concerns neuromuscular and orthopedic disorders even from birth. When do I need physiotherapy? Physiotherapy is for anyone in any age that needs help to move and function when they feel pain or can't be active in normal motor patterns. Physiotherapy can prevent injuries and promote normal motor patterns through physical rehabilitation in daily life activities. In conditions, anyone having problems moving, functioning, being active and being healthy in general may need physiotherapy even from birth. Most common dysfunctions that need physiotherapy treatment is cardiorespiratory dysfunction, is the name of the group of disorders of heart and blood vessels. Neurological disabilities, also known as neurological dysfunctions, are diseases of the central and peripheral nervous system. These type of diseases are Alzheimer's disease, ataxia, brain tumors, cerebral aneurysm, epilepsy and seizures, stroke, Parkinson's disease, and more. Syndromes are a set of medical signs and symptoms which are correlated with each other and often associated with a particular disease or disorder. The word derives from the Greek syndromon, and genetic disorders can be the result of genetic abnormalities such as gene mutation or additional chromosomes syndromes such as Angelman syndrome, Down syndrome, Prader-Willi syndrome, etc. Injury trauma is a term which refers to physical injuries of sudden onset and severity which require immediate medical attention. Scoliosis is a medical condition in which a person's spine has a sideways curve. Most common causes of scoliosis are cerebral palsy, muscular dystrophy, and other similar disabilities. But there are many cases that the cause of scoliosis is unknown. Spinal cord dysfunctions can originate from either outside or inside the spinal cord. Damage from the outside of the cord is caused by compression of the spinal cord or injury. The spinal cord may be compressed due to a bone fracture, spine degeneration, or abnormalities. The aim of physiotherapeutic intervention is to facilitate people achieve their goals in levels where physiotherapy is no longer needed. Physiotherapy can help us be stronger, healthier, independent, more flexible, and active. Physiotherapists work in hospitals, rehabilitation centers, private clinics, schools, child development centers, public health units, sports clinics, and universities, and others. How often should I get physiotherapy? The rehabilitation program depends on the condition of the patient, the dysfunction, the muscular system, and everything that concerns the problem itself. In nerve dysfunction disabilities, it will probably need more sessions than an orthopedic rehabilitation program, and it will differ from a post-surgery rehabilitation program. What is the role of the physiotherapist? The role of a physiotherapist as a health professional varies. The physiotherapist has to diagnose problems, implement an intervention program, assess the physical condition, prevent injuries, and help the patient stay healthy. Physiotherapy needs continuing education. In today's practice, physiotherapists specialize in different methods and on specific disabilities. Physiotherapists also spend a lot of their time educating patients, their families, and helping people lead healthy lives. Physiotherapists are highly trained health professionals who provide treatment for people suffering from different physical problems. The physiotherapist's purpose is to improve a person's quality of life. Remember, with physiotherapy, you can only be better. Thank you for watching.